Hi, I'm Nurse Sarah and I'm a registered nurse in New South Wales. I make videos to empower new nurses with foundational knowledge. The topic today is the formula for calculating drip rates. The formula is volume over hours times the drop factor over 60. Let's break the formula down and dive deeper to gain an understanding of the formula. The first block of the formula is the volume, this one here. The volume amount to be administered to the patient. For example, the doctor will chart 1 litre of Hartmann's to be administered to the patient. So we need to do that quick conversion. 1 litre equals 1,000 mils. And that is simply the first part of the equation. So it's 1,000 mils over hours times drop factor over 60. The second part of the equation is the amount of time it'll be running. So if the doctor charts 1 litre, they will also chart what they wanted over an hour. So let's just say, for argument's sake, that's 100 mils per hour. We've got to just do a little equation here to work out how many hours it's going to take 1 litre to get through the patient. So that fraction is 1,000 mils over 100. And after doing the maths, get rid of those, we're left with 10 over 1. So that means that it'll take 10 hours to be administered to the patient. So far, what we've got is 1,000 mils over 10 hours times the drop factor over 60. Let's talk about the drop factor. The drop factor comes in two different numbers. It comes in 20 and it can come in 60. This will be found on the back of the giving set packet. It's really important to have a look because 60 means that it's 60 drops per mil of water, and the 20 means 20 drops per mil. So clearly you can see that if you calculate for the 60 and you give a 20, the calculation is going to be incorrect and the patient's going to receive the wrong. And if you give a 20 to a baby, which should be using a 60, they're going to get a lot more fluid. You can overload them. It can be dangerous. Always make sure that you check the drops per mil in your giving set when you're doing drop factors. The 20 is usually used for adults, and the 60 is usually used for the neonates, like I just said. Let's have a look at the formula. So for this example, we'll catch up. We've got 1,000 mils. We're going to administer that over 10 hours. We're going to use an adult giving set of 20. And let's talk about the 60. The last part of the second fraction is 60. 60 stands for how many drops in 60 seconds. This vital part of the equation will allow us to work out how many drops per minute. Without the 60, we will have how many drops are required for the entire 10 hours. So if you do the sum, 1000 over 10 times 20 over 60, and we end up with 33.333. To work out what that is over 15 seconds, we divide that by 4. That way you are not standing there for half an hour trying to account for drops for the whole minute to get it right. So we have 33.333. We divide that by 4. That gives us 8.3 drops in 15 seconds. Obviously, you're going to round. So after rounding to the closest whole number, we will stand there and we will count 8 drops over 15 seconds. So to recap, the formula is volume over hours times drip factor over 60. So putting it all together, we have 1,000 mils over 10 hours times a drop factor of 20 over 60. It equaled 33.333 drops per minute. We divided that by 4, which gave us a rounded figure of 8 drops in 15 seconds. Please like, share, and subscribe to my channel for more videos and content. Thank you.